Is a Blue Shield off-exchange plan right for you in 2026? Hello, I am Kevin Knaus, an independent health insurance agent in California and also a Covered California certified insurance agent. And there's a lot of changes for 2026, and some people may not be getting any subsidy through Covered California, and that's where you can save some money by going off exchange. Now, off exchange is buying directly from the health plan, not through Covered California. Covered California is the exchange. And it is interesting that some of the carriers will offer some different plans that are not offered on Covered California off exchange, and the rates are usually lower. We do know that the rates for the health plans are exactly the same if you go through Covered California for a bronze, gold, and platinum plans. So if you get a bronze 60 through Covered California with no subsidy, it is the same rate as if you purchased it direct from the carrier. And that also goes for the gold and platinum plans. The silver plans are a little bit different. Covered California has a surcharge. They're kind of artificially inflated, and there's a reason for that. I won't go into that right now. And if you're never getting a subsidy, then you can save money going direct with the carrier. Now, Covered California has some benefits, and that's something you need to consider, because if you're not going through Covered California, you lose some of the benefits. But let's look at PPO rates for Blue Shield. And now the first thing I will mention on those columns to the right, the silver 70, 73, 87, and 94, notice how the rates are exactly the same, because they're exactly the same. But if you qualify for silver 73, 87, or 94, your income is lower, the subsidy is larger, so you're paying less. But they have the exact same rate as the silver 70. Now, Covered California allows the carriers to offer a mirrored image of the silver 70. And when you look at the rate sheets, it will say silver 70 off exchange. There's one little tiny difference in there, and I think it has to do with the ambulance copay. But you can see all of those rates for the same age are lower. So, you know, depending on the carrier and where you live, you might be able to save $15, $30, maybe $40 per month with an off-exchange silver 70 plan versus a silver 70 through Covered California. However, if you offered a silver 73, 87, or 94 through Covered California, you want to take it, because that means you're getting the subsidy and it has reduced cost sharing for many routine healthcare services. Now, if we look at the HMO rates for Blue Shield, again, we see the silver 70 through Covered California is the same as the silver 73, 87, and 94, just like the PPO plans. But the silver 70 off exchange is less. So again, you can save some money if you want a silver plan, and it doesn't make a difference for this Blue Shield. It can be Kaiser or Chinese Community Health Plan or Sharp. The rates will always be less off exchange for the silver plans. Bronze, gold, and platinum will be exactly the same. Now, some of the carriers will offer what we call non-standard benefit design plans off exchange. These are plans that are not offered through Covered California. You can only get them by enrolling direct with the carrier off exchange. And in general, they usually have lower rates. So here's two PPOs from Blue Shield. I've kind of put them side by side so you can kind of compare. The first one in the orange outline is the Blue Shield Silver 2600 HD HP PPO. So that is a high deductible health plan. That's what HDHP stands for. And it means that it is health savings account compliant, which means you can have a health savings account, contribute money to that account, and then take those contributions off on your taxes. And the way a high deductible health plan works is nothing's covered until you meet the deductible. So in this particular case, it's $2,600. So once you have met $2,600 in health care services, then you go into 35% coinsurance. For example, let's say an office visit is $200 and you go and you pay that out of your health savings account. Next time you have an office visit, maybe you have met that $2,600 deductible. So it's going to be $200 times 35%. So that's what, $70? So that's what it would be. Then when your deductible and the coinsurance all equals $7,350, that is your maximum out of pocket, and you are done for the year. The health plan will cover all of the healthcare expenses, prescription drugs, durable medical equipment, etc. So it's not a bad plan, and it is what we call the silver actuarial level, meaning that the average person in the particular region will have 70% of their healthcare services covered when they have a silver plan. So that silver 2600 meets that actuarial level. You may not realize that, but the average person will. Some people will have more than 70% of the healthcare services covered. The other plan that Blue Shield offers is the Silver 1750 PPO. And it's kind of an interesting plan. Many of your routine healthcare services are subject to a set copayment. Primary care office visit is $55, specialist is $85, urgent care $55, labs are $50. There is a drug deductible of $300, so you have to spend $300 in prescription medications. Then you go into the set copayments or coinsurance of 35% for tier 4 drugs. Now, this is where it gets tricky, and you have to really understand how the plan works. X-rays, inpatient hospitalization, outpatient surgery, emergency room, ambulance, maternity are all subject to 35% coinsurance, which means you must meet your $1,750 deductible. Then you go into 35% coinsurance. So if you have met your deductible, and let's say you have an outpatient surgery and the bill is $1,000, 35% of that, you're going to be paying $350, but you have to meet that deductible first. When the co-payments, drugs, deductible, and the coinsurance equals $9,250, that's the maximum out of pocket, and you are done for the year. A Silver 70 off exchange or on exchange has a $9,800 maximum out of pocket amount. So you can see that the Silver 2600 and the Silver 1750 have slightly lower maximum out of pockets because you're bearing more of the cost burden early on. Blue Shield offers an off exchange HMO bronze plan, which is not offered through Covered California. And it's not a bad plan. So it's an HMO, so you need to remember that. But you get primary care office visits at $65, specialist at $85, urgent care at $65, tier 1 drugs $25. All the other drugs, you need to meet a $7,500 deductible, and then you get that set copayment or the coinsurance. Labs are $65, X-rays $115, and those are not subject to meeting that $7,500 deductible. It's a set copayment. But what is subject to that $7,500 deductible is inpatient hospitalization, outpatient surgery, emergency room, ambulance, maternity. So you need to have spent or be liable for $7,500 for healthcare expenses. Then you go into 50% coinsurance for those healthcare services. And then when all of your deductible and copays reach $9,800, you are done for the year. That's your maximum out of pocket. When we look at the rates, now you can't really compare HMO to PPO plans, but just to kind of give you a feel, and this happens to be in Region 18, which is Orange County, you can see the bronze 60, let's just use age 23, 476. The bronze high deductible plan is 474, and that's either through Covered California or direct with Blue Shield. But if you go off exchange with that bronze 7,500, it's 353. Now this is for a 23-year-old, but that's quite a savings. And then that savings goes through as even when you're older. So that bronze plan 7,500 is not bad. It's affordable. When we look and compare the PPO rates for Blue Shield, this happens to be Region 1. If we look at the age 23, you can see the Silver 70, which mirrors the on-exchange Silver 70 through Covered California, $630. You can save about $27 if you go with the Silver 1750, and even more if you go with the 2600 high deductible at $583. Now that's for a 23-year-old. One of the complicated aspects of comparing rates in California is that there are 19 different rating regions. And each rating region, as the name implies, can have different rates, even though you might be in one county and a different region next door, completely different rates. And not all of the plans, HMO plans for Blue Shield, are offered through all of the regions. To Blue Shield's credit, they offer PPO plans throughout California. No other health plan does that. But you need to look at the rates. I do know that in Region 1, the HMO products are higher than the PPOs. So you need to look at the PPO cost, the HMO, and make sure, especially if you're buying off exchange, that what you're getting is the best fit for your budget. So it can be a little bit complicated because we're in the 19 different rating regions, but you can save money if you're never getting a subsidy by going off exchange. Blue Shield has some good off exchange plans. Blue Shield PPO has probably the largest network of any health plan in California. The HMO, obviously the network isn't as big and it has the HMO restrictions, but can be very cost saving for people that are looking for a good health plan off exchange from a California company, Blue Shield of California. If you have any questions or comments, you may leave those down below and I will do my best to answer them, or you can contact me directly through my website. Otherwise, have a wonderful day. I am Kevin Canals for InsureMeKevin.com.